Hello students. Today we are going to discuss one of the most important topics of pharmacology, that is adverse drug reactions. We will classify adverse drug reactions and discuss quickly all different types of adverse drug reactions. A quick overview of the entire concept. This video is sixth in the series of videos on general pharmacology. Now, as we all know that no drug can produce only one single effect. Apart from therapeutic effects, drug also produce harmful, undesired and unpleasant effects at therapeutic doses. So the World Health Organization or WHO defines adverse drug reaction as a response that is noxious, that is harmful and unintended and occurs at the doses normally used in men for prophylaxis, that is prevention, diagnosis or therapy of a disease or for the modification of physiological function. So all harmful and undesired effects of a drug produced at the therapeutic doses are termed as adverse drug reactions. Now let's quickly classify adverse drug reactions. This is a classification of adverse drug reactions. Adverse drug reactions are classified in 6 main categories. First is type A. Type A are the augmented responses of a drug. Augmented responses are the exaggerated or increased responses of a drug at normal therapeutic doses. These are highly predictable responses of a drug, and mostly these adverse drug reactions are not serious. Augmented responses include side effects, secondary effects and toxic effects of a drug. We will discuss each one of them while discussing augmented adverse drug reactions. Now, second type of adverse drug reactions are type B reactions, that is bizarre reactions. Now, these are highly unusual or strange reactions. These are unpredictable and are not related to the dose of a drug. Now, bizarre reactions depend on the patient's response to the drug, and they can be serious also. Bizarre responses include drug intolerance, hypersensitivity reactions or allergic reactions, and idiosyncracy. Now, the third type of adverse drug reactions are type C. Now, these are caused because of chronic or continuous exposure to a drug. Fourth type of adverse drug reactions are the type D or delayed type of adverse drug reactions. Now, these are adverse drug reactions that are usually seen years after the use of a drug or therapy. And these include teratogenic effects and carcinogenic effects. Now, fifth type of adverse drug reactions are type E, and these usually occur at the end of treatment, that is when the drug is withdrawn or when the drug is stopped. Sixth type of adverse drug reactions are type F, and these adverse reactions are caused due to failure of therapy, that is, the therapy fails to give therapeutic effect. Now, let's discuss each one of these different categories of adverse drug reactions one by one. Now, type A adverse drug reactions are augmented or increased responses of a drug. So, these responses depend on the dose of drug. That is, higher is the dose of drug, more is the response. So, as the dose increases, the response increases, and finally it can result in toxicity. Now, since these are increased or exaggerated responses of a drug, these these adverse drug reactions are predictable, and these are also reversible. These can be reversed on reducing the dose of drug or by stopping the drug. Now, again, since these are the increased responses of a drug, these reactions are associated with the pharmacological properties of the drugs. And these are dose-related responses and are very common adverse drug reactions. And these adverse drug reactions can be prevented by adjusting the dose of a drug. For example, furosemide. Furosemide is a diuretic. It increases volume of urine and it can cause water and electrolyte imbalance. Another example is of propranolol. Now, since propranolol is a non-selective beta blocker, by blocking beta 2 receptors in the bronchial smooth muscles, it can produce bronchial asthma. Now, these augmented adverse effects include side effects, secondary effects, and toxic effect, all predictable responses and related to the dose of drug. Now, side effects are undesirable, unavoidable, pharmacodynamic effects of a drug at therapeutic doses, as no drug can produce only one single therapeutic effect. For example, glyceryl trinitrate, it is a vasodilator. It dilates blood vessels and relieves angina pectoris, which is the desirable effect of glyceryl trinitrate. Now, since glyceryl trinitrate dilates blood vessels, it also produces postural hypotension and throbbing headache, which are undesirable side effects of glyceryl trinitrate. Now, a very important aspect of side effects is that in case of few drugs, their side effects are also useful and are also used in the treatment of other diseases. For example, minoxidil. Minoxidil was first introduced as an antihypertensive drug, but it was found to produce hypertrichosis, that is, it caused excessive hair growth. And later, topical formulation of minoxidil was found to be useful in male pattern baldness, that is, to grow hair on the scalp. Now, another type of augmented adverse drug reactions are the secondary effects of a drug. Now, these effects are the indirect consequences of the primary or main action of the drug. For example, corticosteroids. Corticosteroids produce immunosuppression and they are useful in the management of diseases like severe asthma. Now, since corticosteroids reduce immunity of the body, they can activate latent tuberculosis. Now, activation of latent or inactivated tuberculosis is a secondary effect of corticosteroids which is undesirable. Another example is of tetracycline. Tetracycline is a broad spectrum antibiotic. It inhibits pathogenic bacteria. But apart from inhibiting pathogenic bacteria, tetracycline also inhibits beneficial bacteria which are found residing in the colon. Now, this inhibition of colonic bacteria leads to superinfection. So, these are the secondary effects of a drug. Now, next type of augmented adverse drug reactions are the toxic effects. Toxic effects are the adverse effects which are produced at high doses of a drug. So, overdose or prolonged use of a drug causes exaggerated or enhanced pharmacological action of a drug, and these pharmacological actions of drug are highly toxic. For example, high doses of heparin. Heparin is an anticoagulant. High doses of heparin causes bleeding. Then barbiturates. Barbiturates are sedatives. Barbiturates produce coma at high doses. Then morphine. Morphine is an opioid analgesic, a very powerful, potent painkiller. Morphine overdose causes respiratory failure. So these are the examples of the toxic effects of a drug. Now, after augmented adverse drug reactions, second type of adverse drug reactions are type B. Type B adverse drug reactions are bizarre reactions. These are highly unusual or strange reactions which depend on patient's response to a body. That is, the patient shows strange responses to the drug which can occur at the smallest dose of a drug. So, these responses are not related to the dose of drug, and these are highly unpredictable and are very less common because they depend upon patient's physiology and functioning. Now, these are most of the time these are serious. So, these are more serious and can require withdrawal of the drug, and in some cases hospitalization is also necessary for the treatment of these bizarre adverse drug reactions. Now, these adverse drug reactions include drug intolerance, hypersensitivity or allergic reactions to a drug, and idiosyncracy. Now let's first talk about drug intolerance. Drug intolerance means that the patient is unable to tolerate the drug. That means the patient is highly sensitive to drug, and thus characteristic toxic effects of a drug are produced at the smallest therapeutic doses. And in other words, we can say that there is a low threshold of individual to the action of drug. For example, one tablet of chloroquine may cause vomiting and abdominal pain in some individuals. Then tinnitus. Tinnitus, that is the ringing in the ears, is produced only in few individuals after a single oral dose of aspirin. So these are the examples of drug intolerance. Now, a second type of bizarre adverse drug reactions are hypersensitivity reactions or allergy to a drug. Now, these reactions are immunologically mediated, that is mediated by the immune system of the body. Immune system is hyperactivated, and thus the immune system shows exaggerated or extremely high response to a drug, which results in allergy. Now, allergic reactions occur when the sensitized individuals are re-exposed to the same drug. Now, these allergic reactions can be humoral, that is, allergic reactions are mediated primarily by the production of antibodies, and these allergic reactions can also be cell mediated, that is, a cell mediated allergy. Now, here allergy is produced by the activation of cells, activation of T lymphocytes. Now, type 1, type 2 and type 3 allergic reactions fall in the category of humoral immunity, while type 4 allergic reactions come under the category of cell-mediated immunity. Now, let's talk about all these 4 types of allergic reactions one by one. Now, type 1 allergic reactions are called as anaphylactic reactions. Now, these reactions occur immediately within minutes of exposure to the drug, and therefore these reactions are called as immediate hypersensitivity reactions. So, these allergic reactions are immediate onset. Symptoms or manifestations of these allergic reactions, they occur within minutes. Now, IgE, that is immunoglobulin E antibodies, are produced that mediate the mast cell degranulation. Now, mast cell degranulation causes release of histamine, and this histamine which causes anaphylaxis, which causes allergy. For example, histamine causes excessive vasodilation. Histamine causes bronchoconstriction. Histamine causes allergic skin reactions. Now, these reactions or anaphylactic reactions, these are heralded or they are announced by symptoms like paraesthesia, that is tingling or pricking sensation. Then, as we have already discussed, release of histamine causes flushing, that is the reddening of skin due to vasodilation. Then this histamine causes wheezing, that is difficulty in breathing. It can cause syncope, that is fainting. For example, penicillin. Now, penicillin is an antibiotic. Now, some patients are found to be allergic to penicillin, and penicillin induces anaphylaxis, which is characterized by all these symptoms, and penicillin causes urticaria, that is the itchy red skin. Second type of allergic reactions are cytotoxic reactions. These are type 2 hypersensitivity reactions in which cells are broken down. There is lysis of the cells, and therefore these reactions are called as the cytotoxic reactions. Now, sensitization of the immune system of the body to the drug or to the antigen releases antibodies. Now, antibodies, namely IgG, that is immunoglobulin G or immunoglobulin M, are produced. Antigen-antibody reaction occurs on the surface of cell, and this causes breakdown of the cell, resulting in these cytotoxic reactions. So, cytotoxic reactions are antibody-mediated cytotoxic reactions. For example, quinidine. Quinidine can cause rupture of red blood cells, and it can cause breakdown of platelets, resulting in hemolytic anemia and thrombocytopenia. Now, some of the most important symptoms of cytotoxic reactions are agranulocytosis, then hemolysis, organ damage. Organ damage is mediated by the rupture of cells in the organs like liver, kidney, muscles. Another symptom of these cytotoxic reactions is a systemic lupus erythematosus. Now, in systemic lupus erythematosus, inflammatory response or allergy or cytotoxic reaction causes injury to the cells of joints, skin, kidneys, brain, heart, lungs, etc. Now, third type, that is type 3 allergic reactions, are also called as immune complex reactions. Now, allergen or the drug binds to the antibodies in the blood to form immune complexes. So, type 3 allergic reactions are circulating immune complex mediated reactions. Now, these immune complexes, they precipitate in the tissues. Now, by precipitating in different tissues, they induce inflammatory response. Now, symptoms of type 3 allergic reactions are rashes on the skin, then serum sickness, and an allergic reaction that is characterized by fever, then arthalgia, that is pain in the joints, lymphadenopathy, that is enlargement of lymph nodes, all because of the hyperactivation of the immune system of body. Other symptoms are arteritis, that is inflammation or swelling of blood vessels, arteritis nodosa, that is formation of nodules in the walls of arteries due to allergy and inflammation. Another symptom is the Stevens-Johnson syndrome. Now, this is a severe allergic reaction which can also be fatal. Now, infliximab, it is a monoclonal antibody used in the treatment of autoimmune diseases. Then another drug, omalizumab, another monoclonal antibody used in the treatment of severe asthma, are associated with serum sickness like type 3 allergic reactions. Type 4 allergic reactions are called as delayed hypersensitivity reactions, as they usually occur days after exposure to the drug or allergen. Now, these are mediated through sensitization of T lymphocytes. That is, this allergy is mediated by the T cells. And these reactions, allergic reactions, are termed as delayed reactions, as allergic reaction occurs in more than 12 hours after exposure to the allergens. And symptoms include contact dermatitis, rashes, fever, photosensitization, etc. Example, neomycin antibiotic cream can cause contact dermatitis characterized by skin rashes, redness, blisters, peeling of the skin. So this is about all 4 types of allergic or hypersensitivity reactions. Now, after allergic reactions, let's discuss about the third type of bizarre reaction, that is the idiosyncrasy. Now, the third type of bizarre reaction is the idiosyncrasy. Now, this is genetically determined abnormal reactivity to a chemical. Now, drugs interact with unique, peculiar features of the individual and produce idiosyncratic reactions. For example, barbiturates cause excitement and mental confusion in some individuals. So, this is an example of idiosyncrasy where very unusual or the strange response to the barbiturates is produced. Barbiturates cause excitement and mental confusion. Another example, quinidine can cause cramp, diarrhea, purpura, asthma and vascular collapse in some patients. Again, very unusual response to quinidine. Hemolytic anemia is observed in patients with glucose 6-phosphate dehydrogenase deficiency after treatment with primaquine. So these are the examples of idiosyncratic reactions. After type 2 adverse drug reactions, that is the bizarre reactions, let's talk about type 3 adverse drug reactions. These are type C adverse drug reactions, and these are caused because of the chronic continuous administration of drug for a long time. So these reactions are associated with cumulative long-term exposure to the drug. That means these are related to the cumulative dose of a drug and because of the long exposure to a drug. For example, long-term use of corticosteroids can cause hypothalamic pituitary adrenal axis suppression. So this is the type 3 adverse drug reaction. Now let's talk about the type 4 adverse drug reactions, that is type D. So fourth type of adverse drug reactions are type D. Type D adverse drug reactions are the delayed adverse drug reactions. Now these are termed as delayed adverse drug reactions because these adverse effects occur or they become visible or apparent years after the use of drug or therapy. Now these delayed type of adverse drug reactions include teratogenicity and carcinogenicity. Now teratogenicity refers to fetal abnormalities produced by the drug when the drug is administered to the pregnant woman. Now, a very well-known example is of thalidomide disaster, where use of thalidomide during pregnancy caused rare birth defects. Now, there was severe malformation of upper and lower limbs. Infants born with the phocomelia had severely shortened or sometimes completely absent arms and or the legs. In some cases, hands or foot were directly attached to the trunk. That means hands or foot were directly attached to the body. The limbs were completely absent. And these limbs were termed as seal-like limbs. Seal is an aquatic animal. Now, second type of delayed adverse drug reactions are the carcinogenic reactions, that is carcinogenicity. Carcinogenicity refers to genetic defects and cancer produced by a drug. Now, patients were treated with cyclophosphamide, an anti-cancer drug. And after many years of treatment with cyclophosphamide, patients developed bladder carcinoma. So this is an example of how drugs produce carcinogenic effect or carcinogenic adverse drug reaction. Now let's talk about the type E adverse drug reactions. Now type E adverse drug reactions occur at the end of treatment. That is when the treatment is over and the drug used is stopped suddenly. So it usually occurs after sudden withdrawal of the drug. For example, use of corticosteroids in the treatment of severe asthma. Now acute adrenal insufficiency may be precipitated by sudden withdrawal of corticosteroids therapy. Then another example is of use of phenytoin in the treatment of epilepsy. Now, frequency of seizures may increase on sudden withdrawal of phenytoin. So, drugs like corticosteroids and phenytoin should be gradually withdrawn. They should not be suddenly withdrawn at the end of the treatment. Now, let's talk about the last category of adverse drug reactions, that is type F adverse drug reactions. Now, failure of therapy is often caused due to drug interactions. For example, phenytoin and rifampin, these induce or they increase synthesis of cytochrome P450 enzyme. And cytochrome P450 enzyme metabolizes oral contraceptives. So, failure of oral contraceptive therapy occurs in the presence of enzyme inducers like phenytoin and rifampin. So, this is in brief a complete overview of adverse drug reactions. Please note that the information provided in this video is meant exclusively for students from their examination point of view. So, do not use this information for the clinical purpose. Now, if you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.